हेलो फ्रेंड्स, वेलकम टू माय चैनल क्लिनिकल बायोकेमिस्ट्री बाय डॉक्टर पी के प्रभाकर। आज हम बात करने वाले हैं टुडे आई एम गोइंग टू टॉक अबाउट वन ऑफ द इम्पोर्टेंट रिसर्च फाइंडिंग which came into the different literatures from the Canada, and that literature, that research actually says that how COVID death is going to happen on the weekends. So according to that research, it is going to say us that Canadian, it is a Canadian study which say that the COVID death, whatever death is going to happen because of the COVID-19, so death is very high during the weekends than the weekdays. And so we will talk detail about that one today. So first, let us understand some of the important point. The first point is what we are going to understand, that what you should know about this COVID death. Okay, so in that case, the coronavirus pandemic, which we have seen roughly 4 or 5 different waves till now it came. So the coronavirus pandemic has been quite unpredictable because we don't know when it is going to be on peak, when it is going to be subsides. So it is very unpredictable, not just in terms of its indecent mutability, how they are going to be mutated, but also in this with the regards to how it affects different individuals, because in the same family different individuals is going to be affected differently. While some people experiences no symptom at all, although go on to the develop severe complications leading to the hospitalization and even death. So although COVID-19 death were considerably lower during the Omicron, because Omicron, its transmissibility rate was very high, but it was not going to cause that much of complications. Hospitalization rate was very less. So lower during the Omicron induced wave was there. So a new study reveals that the number could be higher during the certain day of a week, and let us find out all about this one. So what this study is going to tell us actually. So according to the study which is conducted by the researchers at the University of Toronto in the Canada, global COVID-19 death on the weekends have been higher compared to the weekdays during the coronavirus pandemic. The study found that the average number of global deaths from the SARS-CoV-2 virus were 6% higher on the weekdays. If they have compared it, roughly 8,532 on the weekends compared to the weekdays, it was roughly 8,000. So roughly 500 death was higher throughout the pandemic. The team of the researchers studied all deaths reported to the WHO COVID-19 database between the March 7, 2020 to 7 March 2022. Means this study is roughly for 2 years data. So that is the study, and then we will see what is this research finding tells us about that one. What is the exactly research finding? The finding of this study, which will be presented at the this year's at the European Congress of the Clinical Microbiology and Infectious Disease in the Portugal's later this month, were as follows. First, the United States had an average 1,483 weekend COVID-19 death compared to 1,220 on weekdays. That is roughly 22% higher on the weekends. Brazil had an average 1,061 weekend death compared to 821 on the weekdays. That is roughly 29% on higher on the weekends. Similarly, at the Britain or United Kingdom had an average 239 weekend deaths compared to 215 on the weekdays. That is roughly 11% higher on weekends. After analyzing all these averages number of COVID-19 deaths on individuals' days of a week, the study further found that the differences in the number was much bigger when comparing Sunday to Monday. That is 8,850 compared to 7,219 deaths, and Friday to Monday 9,086 compared to 7,219. So means 7,219. However, one of the researcher, the Dr. Fija Manjoor, noted that the differences not did not account for all the countries, since COVID-19 death on weekends 137 in Germany was lower compared to the weekends. So it is this is not applicable throughout the world, because most of the country where higher death was there it was most of the death on the weekends compared to the weekdays. Uh, so, what is the more our this finding suggests that this problem is not resolving despite improving health system performance and awareness over the course of the pandemic. Researchers accepted that the reporting delay was probably to blame, but shortfall in clinical staffing capacity of the hospitals experiences could also be some of the contributing factors. Now, the role of vaccination in this COVID-19, we will see. Uh, while new emerging variants, as we have seen, a number of variants have come. First, COVID-19, in the COVID only we are having alpha, beta, gamma, delta, up to uh, Omicron it came. Then we are having different Omicron sub-variants. We are having B1.1, 1.2, 1.3, 1.4, BA. Then we had XE, XD, and other different variants. And no, so every day we are roughly getting the new kind of variants. So while the new emerging variants may affect the efficacy of COVID-19 vaccines, leading to the breakthrough infections, still getting yourself vaccinated at the best shot against the SARS-CoV-2 viruses. So that is the most effective way to protect ourselves. For those eligible for COVID booster shots, must receive them immediately so as to re-exposure your body for the immunizing antibody, the memory of which may have been lost over the time. Besides following COVID-19 appropriate behavior, also which is wearing your mask, maintaining social distance, continue to be an integral step of the COVID-19. So be protected, save yourself. This is all about for today. So this was a study which I want to share with you. Thank you very much. Have a nice day.